How are kidney? How do I know that I have kidney stone?
Well,
to a layman, to somebody out there listening to us, how would they be able to know that that's not just an ordinary pain, but kidney stone?
Well, first of all, you need to have complaints, because otherwise, how do I know that I have lung problems? How do I know I have bowel problems? You need to have complaints. Now, if you have complaints, the first thing is that you go to your huisarts, your general practitioner. Of course, if the pain is severe, you go immediately to the emergency room. You go to the hospital, of the spoedeis in de hulp. But if you see a doctor, what he will do, and if he has a suspicion that there are kidney stones, he will make specific pictures of the kidneys.
Okay.
You can make an ultrasound.
Yeah.
You can make an abdominal X-ray.
Yeah.
Or you can make a CT scan.
CT scan.
So all these pictures help you to look at the kidney, and you can very nicely see stones on that.
Sometimes when people are diagnosed that when doctors are diagnosed that a patient has kidney stone, they sometimes assume that it will pass by itself. How long does it usually take before it passes?
That's a good one. Very good question, because if you have a small stone, let's say 5 millimeter, 8 millimeters, it can take 1 day to pass, but it can also take 6 weeks to pass.
Wow.
So in 6 weeks, you can now and then have a little bit of complaints. When the stone passes, it's fine. But when you have severe complaints, or you even develop an infection with fever,
yeah,
or if the stone doesn't pass, you have to not only see us, but we have to treat you. And most of the time we have to try to help you to get rid of the stone. If it doesn't pass, you need to treat it with a kind of surgery. And if you want to discuss with me about the treatment options, let me know.
Yeah, we will be discussing that later on. But we still want to let the listening audience know exactly, because these are some of the questions going on in their heart, and you are really helping them, Doctor. God bless you. Now, where do kidney stones form?
Where they form?
Yeah.
Well, they can form in the kidney itself.
In the kidney, okay.
And you can, people say, well, how does the kidney look like? Well,
like a bean.
Well, yes, but you also can consider, it looks like a bean, a big bean.
Yeah.
And the other side looks like an apple. You know, in the apple, you've got the meat that you eat, and inside you've got this...
The seed.
The seed, yes. And the seeds are like the stones inside in the collecting system in the kidney. So the meat, what does the meat do? The meat is a kind of filter, and the filter helps to clean the body.
Yes.
Now, when it cleans the body, small pieces of sand and stones come into the inner side of the kidney. Normally you pee them out, but they're a form like the inner seeds of an apple. And the seeds are small, but they can grow. And that's how the stone is formed.
Is it from the water we are drinking, or is it from, because sometimes you avoid eating sand and eating some seedy
okay. I hear you. Well, one of the things is, for example, people that drink a lot of tea.
Oh.
You can get stones from tea.
Oh.
You have a certain product in the tea. And what already years ago has been recommended, put a little bit of milk in the tea, because this takes out the product that makes stones. A little bit of milk. So a cup of tea is not a problem. 2 cups of tea is not a problem. But if you drink a lot of tea every day, that's a problem.
Oh!
Yeah.
Because sure. I drink a lot.
Good. Maybe you're one of my future patients.
Wow. Well, listeners out there, you can hear from Professor himself telling us that a lot of tea is not good for our system. Water is good, but not tea. Okay. Are there different types of kidney stones? If so, what are they?
Okay, it's a very good question. Because most of the stones, they contain calcium.
Calcium, yeah.
And most of the stones contain oxalate. Calcium oxalate are 85% of all the stones.
Okay.
So then you have a normal stone. But you can have stones that are made from urine acid. You can have gout. You know, gout is when you have pain in your joints.
Okay.
And there are small pieces again of fragments of urine acid that are in your joints, but they also can come in your kidney. You develop a very special stone, which is called the urine acid stone.
Okay.
And this urine acid stone, it already says it's acid.
Acid, okay.
And you can dissolve these stones by drinking more alkaline fluids. That's for the treatment.
Yes, we'll be
That's
coming
one of them.
there.
Yes.
So
The other thing is you can have cystine stones.
Cystine?
Cystine, yes. That is one of the hereditary
stones,
but they are very rare.
How do you pronounce it? Cystine?
Cystine, yes, with a
Okay.
C-Y-S-T-I-N-E.
Okay, cystine.
They are very rare.
Okay.
But if you have them, you are in deep sugar, because they come back and come back and come back. Another form of stone is an infectious stone disease.
Infectious, okay.
Let's say if you have infections in your kidney, that can make a stone.
Yeah.
And that stone is maintained and growing by infection, and the infection is maintained by the stone.
Okay.
So you have suddenly an infected kidney with stones, and it's a very special type of stone. You need to get rid of that stone, infection is gone.
Wow.
So you have different type of
yes.
That's why you need to know a lot about the different types of stones and how to best to treat them.
Exactly. But you know, Professor, why is it that you people don't make information very available for the patients until they come?
Let's see. Let's see about let's see about the information. Well, I think it's a very important question that you say. People would like to have information, because we know that kidney stones and kidney problems, also kidney cancer, is an important issue. The AMC has started a kidney center.
Okay.
We've got a website, and on this website, which we are improving and working on, we put information about how do you get kidney cancer, but also how do you get kidney stones. How should you diagnose them? How should you treat them? If you want, I can give you the information about that website, and you can share it with your listeners.
I think that is very, very good. But on a very practical note, you know how wonderful it will be that one evening we can have people like you, and then the migrant community of people are seated in a big hall, and then we have, you know, doctors, maybe about 3 or 4 for that evening, just for 2 hours or 3 hours, and then they can tell the community, they can share their passion to us and tell us what to avoid. I mean, that would be more practical. It will be more practical than somebody going to the website. And it's not everybody that can read.
Listen, let's make a deal. It's in the evening. If you bring some good food, I will come and share all my knowledge with you.
Thank you, Professor. Now we are still on our health segment with Professor De La Rosette, and shortly we'll be talking about the treatment. But we still have to ask you one more question. Why are kidney stones very painful?
Oh, yes. So what happens is, if you want to swallow something, and it sticks in your throat, and you cannot get it down, it hurts a lot. And you start to squeeze it down, and you start to a little bit. Well, the same happens in your body. When the stone is in your kidney and wants to pass in the direction of the bladder, there is a small tube, which is also for the urine passage from the kidney to the bladder. And that is thin. So when you have this stone in the kidney and you want to push it through the thinner tube, it's like choking, you know. And then when it tries to squeeze itself down, it starts to hurt. And every time it cannot get down, it hurts, and you feel it. So it's not the stones as such that are painful, but the fact that they cannot pass, and they try to squeeze themselves down, and the kidney is not liking this at all. The kidney says, Jesus, there is trouble in paradise. And that's what is sharing with us.
Oh my God. Professor De La Rosa is a very funny person, but he is still busy, down to earth, speaking out of his passion on stone kidney. Least but not all. Just one more question before we go to the treatment. How prevalent is stone diseases?
How prevalent, yes. So, in the north of Europe, where we're living here, it's about 5 out of 100 people have kidney stones.
Okay.
Now, the interesting thing is that when you have a stone, you have 70% chance that it returns in a period of 5 years.
Okay.
So you got a stone,
yeah,
you remove it, and you get 70% chance that it recurs in 5 years. Now, if you come from warmer countries, it's up to 15%. 15 people out of 100 can develop stones. And the same is there, you remove the stone, you have a high chance that it comes back again.
So what are risk factors for kidney stones?
Risk factors include, amongst other things,
Tell us.
the weather. So if it's hot, you perspire, you have a higher chance that you make stones.
Okay.
The second is not drinking enough.
Not drinking enough.
Because people think if I drink a lot, I need to go to the toilet often.
Yes.
So let me wait. Elderly people may have this problem. So they are sitting at home, don't drink enough, they make easier stones.
Okay.
And the third group is that people that eat a lot of meat. So if you have a barbecue every day, that's good for your stomach, but it's not good for your stones.
Is it a red meat or is it a white meat?
It's whatever. It's meat.
Okay.
Meat with a good sauce on it and a little bit of salt, that gives you stones.
Wow. Well, we have really spoken on the causes. Now we want to know about the treatment. So just wait a minute and let's take a pause.
That's where I come in. That's what I like. Because I like to remove the stones. It's very nice.
That is your own area.
It's my area of expertise and I like it a lot.
So listeners out there, don't forget this is our broadcast this morning with Professor de la Rosette, the head of urology department of AMC. We are talking on kidney stones and we are about to talk about the treatment, and that is his area of specialty. Doctor, please, can you tell us how many operations you perform regarding to this issue?
Well, first of all, operations. If you say to the listeners, if you say, listen, operations, they're all afraid.
Yeah.
They turn down the radio, they won't want to hear.
How many people, that's it. How many people do you treat in a month or in a year who have this?
Well, I tell you first, the first choice for kidney stones of treatment is that you can say, you can pass it spontaneously. That is a big number. Let's say 1 out of 3. It has a small stone and pees it out.
Okay.
Then you have a big number where you can say that without surgery you can treat it. And that is with shockwaves.
Yeah, the shockwaves.
The niersteenvergruizer. You destruct the stones by shockwaves. That is about another 1/3. And that goes rather well. You go lie on a table, you sleep a little bit, greens are shocked, and you pee them out. But there is a significant number where the stone is too big, and it's in a not good condition. You need to do surgery, and there are 2 options.
Okay. So is it safe to let a kidney stone go without treatment?
No, you should treat it.
Treat it.
You know, you should treat it. Because if it gives complaints, you have it, it will grow.
So would you now tell us those treatments in elaborate?
There are 2 wonderful treatments we have to offer, and I must say, we are specialized at the AMC.
Okay.
I may proudly say that we are the best equipped unit in the whole of Amsterdam for stone treatment.
Okay.
And I can say I've got gifted hands that guide the instruments to success. So which instruments do we use? You have 2 types of access.
Tell us.
First of all, you sleep.
Okay, sleep.
You don't know anything what's going on. You don't feel any pain while I do the surgery, of course.
All right.
Then what I can do is, if you have your kidney in your flank, and if it's a big stone, I can put a needle directly through the skin in the kidney, the special operating technique. Then I can look through that needle in the kidney, I can see the stone, and with special instruments I can destroy the stone and pick it out in pieces.
How long does that take?
1 hour. 1 hour of fantastic surgery.
Wow.
You take the stone out, it's fantastic. It's for the surgeon one of the nicest surgeries.
But there are some people, Professor, who do not like to be put to sleep while these things are going on. How do you handle them?
I talk to them. They have to trust me. I'm the doctor.
Okay.
And they should not be afraid for me, you know.
Yeah,
They should not be. The second option is that you say, well, if the stone is smaller, we have very nice instruments. We can sleep, and we go via a very thin instrument through the bladder.
Yeah.
Yeah, you know, we have the peeing tube, the bladder, and then instead of going, you know, from the kidney, the urine goes down to the bladder, we move from the bladder towards the kidney with a very thin instrument.
Very thin.
And it's like, you can say it's a very thin thread,
Yeah.
and we can bend it in all kind of angles. We can look around in the kidney, we can see the stone,
Yeah.
we can destroy it with very small instruments like lasers, and we have very small graspers and to take all these stones out. It's very nice.
So that still takes about 1 hour?
Also 1 hour, yes.
Is shockwave treatment painful?
No pain, no gain. It is a little bit painful, but not really sincere. You have nowadays very good medication to take most of the pain away.
Okay.
But no pain, no gain. But if you have pain, you want to get rid of it.
So how safe are these treatments? I mean, shockwave lithotripsy, or uteroscopy, because you know,
whatever, the surgery is. So you can say,
how safe are they?
Shockwave is very safe. You know, we are using this now already for 30 years, and it's a very safe treatment. To do surgery, you know, every type of surgery can have some side effects. But we have improved our technology so much, the instruments, and we are skilled surgeons. We are focusing on a certain condition.
Yeah.
There is always a risk doing surgery, but you know, not to treat also has a risk.
Yes.
And in the balance, not to treat, and that would be my message, the risk and the damage can be bigger than to treat. So if I look in the balance is in favor of treatment.
Yeah.
Because not to treat is not good enough. What is the biggest risk? The biggest risk, if I have a stone, I have complaints, and I don't treat it, there may be a moment that the pain goes away. But that is not a good but a bad sign. Why? Because if you don't treat the stone can start to cause damage in the kidney and can completely destroy the kidney.
Oh.
You lose your kidney without any complaints. So if you have complaints and you know you have a stone, have it checked, have a look at it, maybe you can follow it up to check it, but don't just ignore it. Don't say, hey, the pain is away, it's nothing.
Yeah.
Be sure that the kidney stone doesn't cause damage to your kidney. Clear message?
Very, very clear. So you don't need to entertain it.
No.
Or endure the pain.
No.
You just have to go to the doctor.
I would have a look at it and say, well, what is causing my pain? I want to know if there is a stone, how big is it, where is it, and then discuss, does it need treatment? Very, very important.
Which of these treatments, tell me very sincerely, which of these treatments do you recommend for somebody who would like to remove his stones? You need to
go for individualized treatment.
Have you done that, Professor? Because you said you had...
No. You need to have individualized. Because if you have a very big stone, you can say, I want to have shock waves, but it is not good for treatment for this stone. It's too big.
Okay.
If you have a smaller stone, you can say shock waves.
Yeah.
If you have a big stone, you need to have bigger surgery.
Oh.
If you have small stones, smaller surgery. So, having said this, there is no standard treatment. So let's say on a hypothetical base, if I go shopping in the city and you say you go shopping for a jacket, you look at me and you can say, I got a jacket here for you.
Yeah.
But it's too small. Or for this big man it's even too big. So what you need to look for the exact size that fits you well.
Yeah.
Okay, you need a jacket, which means a treatment, but you need exactly look for the size of the treatment. And that's for stone treatment the same. You should not say, well, for this treatment is good for everybody. You should say, well, he has this stone, it's located there, And this is the best treatment. This is the first choice. If it doesn't work, you have always a second choice.
Yeah.
But there is a treatment that you should never offer because it doesn't work.
So, do small retained fragments of kidney stones after lithotripsy increase the risk of stone recurrence?
Yes. If there are small fragments, you can safely follow them.
Okay.
But if they do not increase, it's not a problem. If they don't give complaints, it's not a problem. But most of the time, a small stone starts growing again, and you need to retreat it or try to get rid of it.
Oh, so a patient will require further treatment after kidney stone is eliminated? Will a patient require that? Further treatment?
Well, most patients,
after it is eliminated?
yes, they would like to get rid of all the stones.
Because you said earlier on, after 5 years,
yes,
sometimes it reoccurs.
It reoccurs, yes. It can be because...
So how do we make sure that it doesn't reoccur?
To make a new picture. You know, then you are sure that it doesn't recur, but prevention is the magical word.
Okay.
And prevention comes back again. If you are a stone former, drink a lot, especially when you are in a warm area. But also look, if you eat too much meat, reduce it a little bit. We talked about tea, but another thing which makes stones is, for example, chocolate.
Oh!
If you eat a lot of chocolate, that's also not good.
Yeah.
Hey!
Really?
That is bad, isn't it? To know that.
Yeah.
Now we get our...
You should have said that earlier on, doctor.
We get Christmas, you want to give each other chocolate, but eat it, but not too much. When you make stones.
So we are almost coming to the end of this broadcast, but just one more minute. How can kidney stones be prevented?
How can they be prevented?
Yes, by not eating chocolate and drinking tea.
Yes, the best is, just the best, drink enough. And drink enough, which means when you are in Amsterdam, you drink 2 liters per day. And if you go to Nigeria, make it 3.5 liters.
3.5. You have heard it out. Somebody out there, you've heard the doctor himself saying it. Drink more water. And finally, how important is diet in preventing reoccurrence of kidney stones?
Yeah, I would say it contributes, but it's not the main factor. But again, everything in your diet that you exaggerate, that you eat a lot of this or a lot of that, try to make it more balanced, your diet. And especially there are a lot of people that like to eat a lot of meat. Maybe you should consider to have a little bit more chicken and fish.
More chicken, yes.
You know, that's not a bad idea.
So will Medicare pay for a patient's stone analysis?
Yes, we include that in our program.
Okay.
You need to know which stone is there.
Yeah.
And this maybe also helps you to prevent it again. So if you make, for example, a urine acid stone, we will tell you this is caused by a lot of meat, eat less meat.
Now, finally, what do you have to say to our audience listeners who have heard your wonderful voice today and the analysis of all of this stone treatment? What do you have to say as a message you want to pass to the audience?
Very good. Listen, you are living in a wonderful city, in a wonderful area. You're living in the neighborhood of a specialized hospital that takes care of stone disease.
Okay.
So if you have a complaint, visit your huisarts or general practitioner.
Okay.
Maybe he makes pictures to diagnose stones, and then you should make an appointment with the urologist at the AMC, and I will welcome all of you there. God bless you.
Thank you so much, Professor De La Rosette. Thank you so
You're
much.
welcome. You're
Thank you. So you promised us that if we will have information section,
I will be
and
there.
you are free.
I will be there.
Thank you, sir.
Good.
Right. Well, Radio Voice of Naija listeners, you have heard it all, and we have just landed safely with discussing kidney stones with Professor De La Rosette of AMC Urology Department. Don't forget, this is the head of the department himself speaking on this topic. So do what he has said and then preserve your health. God bless you.